Hi, I'm Kelsey. I'm going to be your nurse practitioner today. We're going to be doing a head-to-toe assessment. So on general survey, my patient is in no acute distress. Breathing appears to be unlabored, good hygiene, and well-nourished. Can you tell me your name?
Garrett.
Good. Where are we right now?
In a dining room.
Good. What year is it?
2025.
Good. So my patient is alert and oriented ×3. We'll move on to your head and neck. On inspection, the head is normal cephalic and midline. Neck is also midline and trachea is midline. I don't see any enlargement in lymph nodes or the thyroid gland. So we're going to feel preauricular, postauricular, submandibular, submental, superficial and deep and posterior cervical, and then occipital, supraclavicular. So I don't feel any enlargement in your lymph nodes there. And then I'm going to listen for a bruit. So I'm going to have you turn your head that way, take a deep breath, and hold it. Good. Go ahead and breathe. We'll do the same on the other side. So turn your head that way, take a deep breath, hold it. Good. I don't hear a breathe on either side. I'm going to have you look up a little bit. Go ahead and swallow. Good. I don't feel any enlargement in my thyroid. Good. And then I'm going to palpate your scalp as well. Any tenderness with that?
Nope.
Okay, no masses or tenderness, no palpation there. We're going to move on to your eyes. Okay, bright light, look straight at me. Good, pupils are equal, round, and reactive to light. I'm going to have you follow my finger with just your eyes. Good, all extraocular movements are intact. Another bright light in your eyes here, okay? Good. Look at the other one. Good, so I can see the vasculature of both eyes and a nice sharp disc margin. We're going to move on to your nose. Just look up for me. Good. Good. Both nares are patent. I'm going to feel your sinuses here. Tell me if this hurts.
Nope.
Good.
Nope.
Good. Now tenderness in his sinuses. Can you look in your ears? So both ears are nice and round and symmetric. Any pain with this?
Nope.
Good. Auricle lobe and tragus are all mobile with no masses or tenderness. Look in your ear. Good. I can see the bony structures of the tympanic membrane and a nice pearly gray tympanic membrane. And this one here. Good. Same thing on this side. Nice pearly gray tympanic membrane, and I can see the bony structures there. No redness, drainage, or swelling in either ear. And onto your mouth. Alright, go ahead and open for me. Say ah. Stick your tongue out. Good. Okay, so oral mucosa is nice, pink, and moist. Teeth are all intact with no decay. Tongue is pink and is midline when he sticks it out. No deviation, no tremors. Hard palate is domed. Soft palate rises with phonation. Tonsils are 1+. No exudate or edema. No redness noted. Uvula is midline, and then his throat is pink with no redness or swelling or drainage. I think that's all. Okay. Now we're going to move on to your cranial nerves. So cranial nerve 1, we would use the smell. We would have you smell an alcohol pad or something like that. Cranial nerve 2, we already did Perla, or we could use a Snellen chart in the clinic. Cranial nerves 3, 4, and 6 were our extraocular movements we already did, so that was intact. Cranial nerve 5, I'm gonna have you close your eyes. Just tell me when you can feel my touch, okay?
Yep. 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 Yep.
Good. Cranial nerve 5 is intact. Cranial nerve 7, maybe give me a big smile. Brown. Raise your eyebrows. Raise your eyebrows down. Good. Facial movements are all symmetric, so cranial nerve 7 is intact. Cranial nerve 8, and have you cover one ear and just repeat what word I just said, okay?
Apples.
Good.
Oranges.
Good. So cranial nerve 8 is intact. 9 and 10, I'm going to have you swallow. Good. Those are intact. 11, shrug. Good. Turn against me. Turn against me. Good. And then 12 was stick your tongue out. We already did that. We are going to move on to integumentary now. So I'm going to pick a lesion. We'll do this one here. So it is symmetric and round. The borders are regular. Color is a nice brown and it's equal throughout. It's nice and small, less than a centimeter. And has this changed over time?
No.
Good. And then we're going to do chest wall. So I'm going to feel your chest. Tell me if you feel any pain, okay?
Nope.
Okay, so good. No pain or tenderness on palpation, no crepitus felt, no masses. The precordium doesn't have any heaves, thrills, or lifts. I'm going to listen to your lungs now, so go ahead and just take some nice deep breaths for me. A little bit. Good. So lung sounds are clear throughout, equal bilaterally. There's no adventitious lung sounds and no labored breathing. And so now we're going to do cardiovascular. I'm going to listen to you again. So listen to the heart sounds at the aortic, pulmonic, herbs, tricuspid, and then mitral. First with my diaphragm. And then with the bell of my stethoscope. Good, so I can hear S1 and S2. I do not hear S3 or S4, and then I hear no murmurs and no splits. Beautiful. I'm going to feel your pulses now. So carotid. 2+ and equal bilaterally. And have you hold your arms out for me. We're going to do brachial. 2+ equal bilaterally. And move your watch a little bit here. Radial. 2+ equal bilaterally. I would also do femoral. We're going to do popliteal. Go ahead and straighten your legs out. Good. 2+ equal bilaterally. Posterior tibialis. 2+ equal bilaterally. And then dorsalis pedis. 2+ and equal bilaterally. And we're going to do abdomen, so I'm going to have you jump up on this table for me. Okay. His abdomen is nice and round, no distension, no no mass is noted. His umbilicus is midline. So I'm gonna listen to your belly. Good. Bowel sounds are present in all 4 quadrants. Now I'm going to listen for bruits in the aorta, iliac arteries, renal arteries, and then I could also do his femoral arteries, and I don't hear bruits there either. I'm going to press light and hard on your stomach. Tell me if it hurts, okay? Okay, no masses or tenderness noted on palpation. I'm going to feel for the liver. No enlargement of the liver noted, and then I'm going to feel for the spleen. No enlargement of the spleen noted. I'm going to have you sit up on the edge here. I'm going to tap on your back. Tell me if you feel any pain with that, okay?
Nope.
Okay.
Nope.
Okay, no CBA tenderness noted. Now we're going to move on to your extremities. So go ahead and squeeze both my hands for me. Squeeze, squeeze, squeeze. Good. 5 out of 5 strength in both his hands. We're going to move our push up against him. Yeah, pull down. Good. 5 out of 5 strength in both arms. Lift this leg up. Pull it down. Good. Push up. Pull down. Good. 5 out of 5 strength in all extremities. Now we're gonna tell you that you also don't have varicose veins or any edema. The coloring of your extremities is nice and pink and then warm. We're gonna do your deep tendon reflexes. Okay, so we're gonna start with brachial biceps. Go ahead and relax as much as you can for me. Good. We'll say 2 out of 4 on that one. We'll do this one. Ooh, 2 out of 4 on that one too. Those are both equal. We'll do triceps. Good. Relax as much as you can. Ooh, big one there. So good reaction on both of those, and then try not to look. Relax, relax, relax. Good. Relax, relax, relax. Relax, relax, relax. Relax your arm. Ooh. Okay, 1 out of 4 on those. We'll do your patella. Ooh, a little one there. Okay, 1 out of 4 on both of those, and then we'll do your Achilles. Get 1 out of 4 on those as well. And then we're gonna check your balance. So I'm gonna have you stand up. Just walk that way about 5 steps for me, and then walk back. Good. Turn. Head on back. Good. Balance and gait are good there. I'm gonna have you close your eyes and hold your arms out like you're holding a pizza. Yep. Good. Go ahead and open your eyes. Negative Romberg test, so balance is good.